And you click got it so that then it goes away.
Right. So I want to welcome everybody to our coffee and conversation for February 27th, 2024. We are recording today's session, and it will be available on the AARP New Hampshire YouTube channel in a few days. Today we are going to be talking about the VA's foster home program. My name's Mary, and I am a co-host for today's conversation. I'm also an AARP New Hampshire volunteer, and I get to do a lot of fun things like these virtual coffee and conversations. Our guest speaker this morning is Kevin O'Keefe, who is from the Veterans Administration.
Good morning.
And I would just like to cover a few housekeeping items before we get started. I ask that you please mute your line by ensuring that the microphone icon at the bottom of your screen does have a line through it. This will help to eliminate any background noise so that everybody can hear the conversation. We do want to hear from you this morning. So if you do want to ask a question or you have a comment, please feel free to use the chat box, which can be accessed by clicking the chat button at the bottom of the screen. Kathy Hoey, who is also working with me and my fellow co-host, will be monitoring the chat, and she will bring your comments as well as your questions to Kevin. I'd like everybody to know that at AARP New Hampshire, we are focused on the health and the financial security and social connections that are critical to the well-being of the 50 plus in the Granite State. We do a lot of our work through targeted advocacy at the state and federal levels. We have compelling engagements of the 50 plus communities statewide, and we also serve as a trusted resource for information for our members and for the public. Kevin O'Keefe works for the Veterans Administration in Manchester, New Hampshire, and he's part of a team that brings the medical foster care model to New Hampshire in hopes of helping more Granite State veterans. From my understanding with Kevin, this is a new program, so I'm kind of excited, and I hope you are too, as he teaches us about this model and how we can make a difference. Kevin, thank you so much for joining us this morning.
Oh, thank you. It is absolutely my pleasure. Thank you, Mary. And thank you, Kathy. I appreciate all the technical support. And I apologize in advance for any technical difficulties that may occur due to our system here at the VA and me inadvertently muting myself, which sometimes does happen. We'll get on it right away. I would also like to add that this program, and we do have a PowerPoint presentation to show as part of this conversation. It is new to New Hampshire. Medical foster home program is new to New Hampshire, but it's not new in the country. It's been around for over 20 years. And as far as myself, I have been a social worker for over 30 years. And I'm a licensed independent clinical social worker. I am the program coordinator here at the VA for the medical foster home program. And part of my history is also, I've worked with different organizations in New Hampshire, Massachusetts, and Florida in setting up treatment programs, both residential and outpatient. So that's one of the reasons I came to the VA, is because not only my history and strengths in setting up programs, but also my interest in doing such specifically for veterans, to support veterans. So I'm very excited to not only be the program coordinator here in New Hampshire, but also to have this conversation with you folks this morning. And if I can switch over and share my screen, I'll start the PowerPoint presentation. Just let me know if or when you folks start seeing that.
Okay, we can see it now, Kevin.
Fantastic. All righty. So basically, what medical foster home is It's an alternative to long-term care in a home community setting. So these can have these medical foster homes can occur. I'd love to say anywhere in the state of New Hampshire, but it technically needs to be within 30 miles or a 45-minute drive from the Manchester VA Medical Center or one of our community-based clinics, which are located in Tilton, Conway, Somersworth, and Portsmouth. So we cover a great deal of the state, and we also spill over into a lot of York County, Maine is also our territory. And then in the western part of New Hampshire is picked up by the White River Junction VA in Vermont. So it's a comprehensive care, dynamic alternative for veterans who prefer to live in a private home rather than a nursing home. And there are no more than 3 veterans or persons cared for in each medical foster home. And what that means is medical foster home allows a caregiver, a homeowner, to provide care for, it could be 3 veterans in the home, but if they're already caring for a family member in the home and they want to become a medical foster home, that means we would only certify 2 other beds in the home for veterans. So there'd be a capacity of 3 that this caregiver would care for. And we support, us program coordinators, we support the caregivers throughout the whole process, from recruitment, onboarding, certification, inspections, continuing education, and veteran relations. And our caregivers throughout the country, they own or rent the home. They also have to live in the home. And the reason we make that a specific item to address is I have received several outreach phone calls, one from a state legislator who they have on their property, let's say 2 homes on a property. You know, one, it could be an in-law that, or an outbuilding, or just literally another home on the property or next door where they would like to rent to veterans. And that's not the model. The model is what you would think of when you think of regular foster care homes with children throughout the country, where children move in with a family. We'd never put children in a home, you know, on the next door property, unsupervised or unattended. And it's the same model for the medical foster home program with our veterans. We want to support them through a family setting. So unfortunately, that state legislature and some other folks were not able to follow through on becoming medical foster homes in this state, but they're helping to spread the word. And one of the benefits of and criteria for medical foster home is that veterans also need to be supported through something called our home-based primary care team. And it's a benefit because a lot of veterans, frankly, a lot of folks who have a medical condition and find it hard to make your primary care appointments and other appointments in the community. One of the great things about this is the medical appointments come to the veteran at the medical foster home in the community. So it's healthcare services provided to veterans in the home, basically for veterans who need team-based and home support for ongoing diseases and illnesses that affect their health and daily activities. So veterans usually have difficulty making and keeping clinic visits because of the severity of their illnesses and are often homebound, but that is not required. The requirement is, it is not a requirement that veterans are homebound. So folks can be active in the community as well. So this program is also for veterans who are isolated or their caregiver is experiencing burden. Home-based primary care can be used in combination with other home and community-based services. So not just with medical foster home. We like to say we play nice with others. So we like to, if somebody wants connection with other supports and programs, I'm a social worker and we love to connect people. So one of the slogans we have is connection is protection. We as human beings, the more connections we have and maintain, the healthier we tend to be. So our we love acronyms here at the VA. So HBPC, home-based primary care, provides the medical care to veterans and education to the caregiver. And that education consists, we'll have a list later on, but it consists in general, whether it's CPR first aid, general ethics, how to provide and store, medications. But it's also can be specific to a veteran's needs. So the team can provide that specific education to the caregiver, depending on what comes up with the veteran. And folks like myself, the program coordinator, supports the caregiver through the recruitment, onboarding, certification, inspections, continuing education, and veteran relations. One of the things I'm hearing from my colleagues throughout the country is they are called intermittently from either the veterans family members, or the caregivers themselves saying, look, we're having issues around this. Can you come out and meet with us? And that's absolutely what we do. Overall, my job is to provide oversight. The caregivers provide daily personal assistance, supervision, meals, snacks, transportation, recreation, laundry services, and medication administration support. And this doesn't necessarily mean that the caregiver's doing all these things, but the language in the policy and the directive around the medical foster home program is that the caregiver has to agree to support the care plan for the veteran, which includes not just the personal assistance, supervisions, meals, snacks, but also if they need transportation to community events. I know a medical foster home I visited up in Biddeford, Maine. Both veterans were eager to be done with meeting with me. I met with them for 2 hours, and they said, one of them looked at their watch and they said, not to put a rush on this, but I'd like to be at the club at 11 o'clock because that's when they were getting ready for bingo. So I did not want to get in the way of bingo. So folks were very active, and the transportation was supported. It wasn't by the caregiver, it was by other members of the community who were providing the transportation to and from whatever activities the veteran was involved in. So it was just the caregiver would support that happening. So this really is a collaboration and a team approach to support veterans and caregivers. So initially, when a caregiver expresses interest in becoming a medical foster home, it's a simple conversation with myself. After that, if they meet basic criteria for moving forward, and I've done a home visit to do some preliminary look at the home and how it might work, then approval going forward would also include a home inspection by a team. So including myself, another social worker, a nurse, occupational therapist, and or rehabilitation therapist, a nutritionist, and a safety specialist. We have 2 life safety specialists on site here in New Hampshire. Their desks are here in Manchester, and they are fully involved in the certification of homes from a fire safety perspective and life safety perspective. And due to this team, including our safety specialists, the state of New Hampshire has granted the VA a waiver for the medical foster home program So our caregivers do not need to go through a separate state licensing process. Ours is on par with the state licensing process. So we're trying to make it simpler and have less barriers for potential caregivers. And the state has been a fantastic partner for that. So as far as some of the veteran experiences, these are some veterans in Maine who have their families, their caregivers have taken them on, whether it's out in the community on the far right, just to get to the pharmacy, ice fishing. I don't know if any of y'all are into ice fishing. Definitely not in Florida, Kathy, but getting folks out on the ice, and then trips down to DC to the World War II Memorial. So veterans become members of their extended family. So a lot of homes throughout the country are integrating and taking veterans on family vacations. So this is definitely a safe alternative to institutional care for certain veterans who are more medically complex and have disabling conditions who would benefit from interdisciplinary primary care in the home. And there's an increasing demand for care in non-institutional settings, and providing veterans the option to remain in a family setting in a specific community. And I do have to say, I'm going to switch this off for a second, that in meeting with the veterans up in Biddeford, the one veteran in particular, I asked him, I said, how long have you been here, and why'd you choose medical foster home? And his story, I think, spoke to the necessity for medical foster home. He was born and raised in the Biddeford area. He served in the military, 2 tours Vietnam. When he came back from Vietnam, he settled back in Biddeford, raised a family, was employed in the county, and wanted to retire. His spouse had passed. His kids, grandkids live in and around Biddeford. He did not want to go to the veterans home up in Togus, a couple hours away. And when a medical foster home opened up 10 years ago in Biddeford, he jumped at the chance. And he said, look, I get to go see my friends at the club a couple times a week, if not daily. I'm supported here in the home with my needs. He sees his kids and grandkids for dinner every Friday night, and church and lunch on Sunday. And he said, this is perfect. So he said he was a walking advertisement for medical foster home and why it should exist. All right, so that's what we want to provide for veterans in the state of New Hampshire, that opportunity to stay connected in their communities of choice. Okay, I'm going to go back to Sharon for a second.
We do have one question from Mary. It says, do you have to be a veteran to be a caregiver in this model?
You do not. You do not need to be a veteran. And you don't need to be a nurse either. Okay, now I am having difficulty finding my screen to share. Okay, this is why I apologized ahead of time.
Can you see your share screen now?
Okay, here it is. Let me know if you're seeing the slide again. Thumbs up. Oh, fantastic. Thank you for your patience. Okay. And what we've found through data collection over the years is that veterans have had an improved quality of life. They found themselves being safer in a therapeutic environment of being in a home in the community, and the opportunity for being able to be provided longitudinal care in a home, including end of life and palliative care. So as far as how this all started, so I have some pride in this one with two social workers down in Little Rock, Arkansas. So some fellow social workers, they had a serious problem. They were a veteran living alone, was unable to care for himself. So it was unsafe for him to be at home, right? And he wanted to stay at home. So they asked themselves, do we force this veteran out? So, which they didn't want to do, but they also knew they couldn't leave him at home and for him to be, it'd be unsafe. So when they started discussing this with a larger and larger team, they found a willing caregiver to assist the veteran meet his personal care needs, provide supervision with medical care support from, which existed at the time as well, a home-based primary care team. And from there, so that was 1998. 99, it was successfully piloted there in the Little Rock area through the Little Rock VA. Up to 2004, the pilot program was extended to Tampa, Florida, and San Juan, Puerto Rico. From 2004 to 2010, it expanded across the country. And as you'd imagine, with a higher concentration in states with many veterans, mostly down south, warmer states. For some reason, folks don't want to retire up in snow country. So Florida, Texas, and California have the most medical foster homes. In 2010, this was actually briefly piloted in New Hampshire, and it did not last. I don't believe the home was actually opened up for that brief period of time, and it remained on the shelf until what was it, last year, when I was recruited to start medical foster home here in New Hampshire. So as of this February, medical foster home is operational and developing at 157 VA sites and at least 43 states and territories. And I say at least 43 because I know we have 2 sites in Washington State, and they are not on the list on the next slide. So we're at least in 43 states and territories. So still in Puerto Rico, not only at the San Juan VA, but also across the island at the Ponce VA. The 2 thriving medical foster home programs on the island. So we're actually serving just over 800 veterans in over 500 medical foster homes. And the directive from Washington is that this medical foster home program should be established at all VA medical centers by the end of the next fiscal of 2026, the end of fiscal year 2026. And here's the list. And like I said at the end, Washington State is not listed there, and I know for a fact there are 2 sites there. It's quite a list, and we keep growing. There's no age requirement. So our youngest is absolutely 18, and the range right now we have is 21 to 93. And the basic qualifier is that a veteran who can no longer safely live independently and does not need ongoing skilled nursing services. And here's another example as far as the justification for medical foster home. I received a call from a family in York, Maine. They would love to get their father, who is in a skilled nursing facility in Portsmouth. He doesn't necessarily need to be in a skilled nursing facility, but it was the only place where he could receive the care in the area that he needed. So he's there, and they're paying $14,000 a month for care. It is. I'm seeing some wows, and it's just, that's an obscene amount to be paying for care, for a level of care that medically their father does not need. So they would love to get him into a medical foster home in New Hampshire or Maine within, some reasonable driving distance from York. So that's what I'm also working to recruit homes in the New York area. And the cost savings to them would be, I'd say about $10,000 a month if their dad was able to go to a medical foster home. Well, that's just one example. And if you folks are familiar with these, and I spelled them out, but these acronyms ADLs and IADLs. So activities of daily living or instrumental activities of daily living. And the difference would be, bathing and grooming being an activity of daily living versus an instrumental activity of daily living would be food shopping. Right? Being able to physically be able to go out into the community and do your shopping, right? But all it takes is they need assistance with one. And I think medically they call them, if you're ever talking with a medical professional, a nurse, I think they call them also dependencies. So you might hear that as well. But veterans should have a source of income to support the cost of their care. And we'll get into the finances of medical foster home in a second. And as stated previously, veterans must also qualify, be accepted into the home-based primary care team if they're not already receiving home-based primary care services. Some of the examples of who qualifies. So we have a 21-year-old, 100% service-connected veteran with an anoxic brain injury. So they suffered oxygen deprivation to their brain. He has some long-term cognitive deficits, which impairs his ability to care for himself. A 54-year-old non-service connected peacetime veteran with a multiple sclerosis diagnosis. An 88-year-old 30% service-connected veteran bedbound with cognitive decline. So it really does spread across the spectrum as far as who can qualify for medical foster home. Some illness examples. My last presentation, this was a surprise to some folks. A veteran with kidney disease, being on dialysis, schizophrenia, dementia, cognitive impairment, brain injury, TBI, traumatic brain injury, diabetes, spinal cord injury, Parkinson's disease, cancer, and many other conditions or illnesses. So what I want to underline is a severe and persistent mental illness is not a rule out for entry into medical foster home program. Well, here are some of the economics. So it's less than half the cost of nursing home care and two-thirds the cost of a skilled nursing facility, as the example I stated earlier. And the medical foster home rates are negotiated according to the level of care and veterans' resources and ability to pay. And I'll break that out in a second. The agreement is between the veteran and the caregiver themselves. So the VA is not a pass-through. I may be at the table as the caregiver in negotiating what the rates are that the caregiver and the veteran agree to. But in general, the rates are broken down into room and board and care. So it's three parts. And that bottom part is the one that changes over time. Typically, as we get older, we need increased care. We have increased care needs. So that's the piece that'll fluctuate more so than the other two. So this pay is paid directly from the veteran to the caregiver. And the VA is not a pass-through for any of these funds. And I'll put an asterisk on that because some new legislation passed, which changes this slightly, but I'll get to that in a second. Here at the VA, we like to make things a little bit less clear. So feel free to hold on to some questions around this. So it's also supported through other veteran incomes, such as Social Security and any retirement income benefits. Now, some veterans have compensation and pension or aid and attendance benefits. the average cost nationally is $2,800 per month per veteran. So they figure due to, what is it, locality up here in New England, that it would cost slightly more. So $3,300 a month, but that is the national average. Now here's the asterisk. For anyone who paid attention back in December 2022. So we are closely planning for the implementation of the Cleveland-Dole Act that was passed on December 29th, 2022. To support veterans and caregivers, the Office of Geriatrics and Extended Care has been working diligently to develop required data and payment systems and new arrangements for use under this authority to allow qualifying veterans under the Cleveland-Dole Act to be cared for in medical foster homes at VA expense. So it's a long time coming, but it's finally starting to be rolled out. This aligns with with Secretary McDonough's support for home care options for aging veterans. And once operational, we will provide additional information. And you can go on the website, va.gov/geriatrics, and all information about home care is located on that site, and any updates would be there as well. But this is exciting news for veterans and for me as a program coordinator for medical foster home, because this opens up, I guess not opens up, removes some barriers, I should say. Right now, the DC is looking at addressing these systems to support this payment. Right now, to roll this out, they are working with about 200 veterans across the medical foster home program, who what we call priority 1A veterans, who they have a high service connection. It could be Medal of Honor recipients. They have, could be 100% disabled. And these folks who are categorized as priority 1A, they are trying to operationalize this for them first before rolling it out to all veterans for the medical foster home program. So they're going to test it out on a smaller population, get the bugs out, and then roll it out to all veterans who are in medical foster care right now. So this is exciting for us. We can't wait for the rollout. And some of the benefits, year after year, very high veteran satisfaction rate. Veteran choice is supported because it'll be an option, hopefully soon in New Hampshire, for veterans to stay in a community of their choosing. Veterans live in a family setting, celebrating birthdays, holidays together as a family, and it provides flexibility and accommodating. And this is, I should have underlined this one, spouses and pets. So across the country, there are some medical foster homes which have allowed veterans to bring in a spouse and or pets. Because once you lose your ability to live in your home or community, then you have to say goodbye to your connections, including a partner, a spouse, and or pets. I mean, it's just one loss after another. And one of the pieces of flexibility and benefits of medical foster home is that they're able to help veterans maintain those connections. So it's 1 or 2 or 3 less losses that veterans have to manage. And that's an exciting piece, which I really enjoy talking about, and hopefully we'll have to manage soon here in New Hampshire. During COVID, there was an uptick in veterans looking to move to medical foster homes. And as you can imagine, medical foster homes during the pandemic, veterans had to endure less strict social isolation. There were fewer lockdowns and fewer negative effects that come with that isolation compared with older adults and other long-term care settings. And there are some other celebrations from around the country. It was a veteran's 100th birthday, and this was during COVID. So I don't know if you folks ever experienced or participated in the drive-by celebrations during COVID, where there weren't big celebrations with people getting together, but being able to be out on your porch or out on the driveway and having folks come by to celebrate, honk their horns, wave out the window. And some of the support, education, and oversight in medical foster home. So we have frequent contact with caregivers. We support the growth of a caregiver community for self and mutual support. And it's not only through the VA. I mean, we have a caregiver support program here at the VA, but also the state of New Hampshire has one as well. There's a great network through the state of New Hampshire and the VA.
Kevin, we can't hear you.
For caregivers.
Kevin,
Yes.
we couldn't hear you for a while there.
Am I back?
You're back now.
Oh, sorry about that. So I was saying we have a great network here in New Hampshire, both through the VA and through the state of New Hampshire for caregivers. And as far as me as the program coordinator, at a minimum, caregivers will see my smiling face at least once a month. So I assess for, and as does the other folks visiting from home-based primary care, we're looking for signs of caregiver burnout, fatigue, frustration, or their needs, whether it's training needs, extra support, education. And we provide that support and advocacy and education for the caregivers. So that is an official photograph of me. So they will be seeing me. And from what I hear from folks, just from my presentations repeatedly at some organizations, that I have not worn out my welcome yet. So that's what I'm hoping for with caregivers around the state, that I will not wear out my welcome with my unannounced visits. And if anyone's familiar with licensing or certified homes, that is the responsibility, whether it's a state licensed organization or otherwise. There is a licensor that ends up showing up at the home unannounced, just to make sure things are going well. And if not, what we can do to support. So some of the reasons folks choose medical foster home. One, we've already mentioned, to avoid other sometimes costly long-term institutionalized care. The last satisfaction survey that I'm quoting from fiscal year 2021, 94% of veterans either agreed or strongly agreed that they're overall pleased with the medical foster home and wish to remain there. These are smaller settings for care, and it reduces the risk of COVID-19, let alone flu, and there's something else nasty going around right now, that stomach virus around the state. There's just, with less exposure, fewer people living in the home, there's less exposure to illnesses, less chance of lockdown, getting sick. So you'll have more access and better support for connections, not only with family, but getting out into the community and staying connected with whatever activities and people veterans want to stay connected with. Very veteran-centric, including medical and mental health care, food preparation, as well as support.
Kevin, I'm really sorry, but we
and
can't hear you again.
Can you hear me now?
Yes.
I apologize. I think it might be the connection I have that it keeps dropping out. So lots of opportunity to support veterans, not only by the caregiver with food preparation, but also through the VA around spirituality, recreation, mental health care. So it's not just medical care. And frankly, many veterans do not see themselves living in other long-term care settings. I did have one veteran last week say, I'd love to go into medical foster home, but the only other place that I'd consider going to, since there's not a medical foster home in New Hampshire, would be the state veterans home, because there's a stocked fishing pond on campus, and he's a fisherman. So And when I'm recruiting pardon me, when I'm recruiting caregivers, they've a lot of folks throughout the state, they came to be a medical foster home caregiver because they were connected in some way with a veteran, whether it's in their own family or close personal friend that they were supporting. But it really does need to be a good fit to be a caregiver, as opposed to someone who's just looking to make some extra money. And there's a key phrase, and I think I have it on the next slide, as far as one of the qualities we're looking for in a caregiver. Caregivers receive support from the VA in how to care for veterans and specific care needs. We don't want to just, and this is we're not going to just bring a veteran by a caregiver's home with an unknown caregiving need and drop them off and say, you have an open bed and they're staying with you. We and myself particular believe in warm handoffs. So there is very much a warm handoff notification process. Hey, we have this veteran with these needs. Is this someone that you'd be comfortable with? Yes or no? And then, hey, let's go forward. Can we have meet for coffee to see if you folks get along? And after that, we could try a weekend to see, move in for the weekend and see if it's a good fit. So with the VA, it's not just going to be, hey, you have an open bed, Kevin's going to drive by with a veteran and drop them off. Okay. So very much needs to be a good fit. Let's see, where are we? Here it is. I even underlined it. Caregivers need to have a nurturing disposition. This is actually in our directive from Washington. And it could be with personal or professional caregiving experience. So you don't need to be a nurse of any type. A lot of folks who have come to the caregiver role, it's because of family members. That's how I became a caregiver in my family. My dad moved in with us, so I became a family caregiver. Right, so I wasn't trained to be a caregiver. I'm a social worker, but I was never trained to be a caregiver. And just based on that personal caregiving experience, if I was so inclined, I would be a candidate to be a caregiver for the medical foster home program. So caregivers own or rent their own homes. So if someone rents, it would need to be with the written permission of the owner, which is the case in one of our medical foster homes in Biddeford. They've been a medical foster home for 10 years with permission from the owner. They complete an application and pass VA inspections from that team I mentioned earlier, and background check with the New Hampshire Department of Safety and BEAS. BEAS, for those of you who are not familiar, it's the Bureau of Elderly and Adult Services. And I know they don't memorize the name because it is changing soon. I received an email sometime in the last 2 weeks that they're rebranding. It's basically the adult version of Child Protective Services. So Adult Protective Services in other states. This is the New Hampshire version of it. So the Bureau of Elderly and Adult Services, among other tasks, you can do a caregiver background check on folks, which is really nice. And the big difference, this has been one of the questions over time with presentations, is what's the difference? Why would you need to do a BEAS or BEAS background check as opposed to New Hampshire Department of Safety? So one's a criminal one. And what the programs have found over the last 20 years in the United States is that there are individuals who have gone from a caregiver role from program to program to program within a state, doing things which have been inappropriate, but haven't risen to the criminal level. So they may be asked to leave employment, or they're investigated on some level, but it's not reported to law enforcement on the criminal level, but they're just being inappropriate, whether it's being unethical, violating boundaries. So they continue to do this for years without being held accountable. and folks are doing their background checks and finding nothing on them. So these things can be reported to bees. Bees can do an investigation and they'll have a finding, whether it's a founded allegation of abuse, neglect, or exploitation, right? It could be a finding or founded, unfounded, or inconclusive is basic 3 findings. But there'll be a history. Even if it's unfounded or inconclusive, there'll still be a history that when we do the background check, we can find, well, there's been 10 investigations of inappropriate behavior over the last so many years. So that would give us an indication that we may not want this individual to care for our veterans. Whereas the criminal background check may be completely clear. So this helps protect our veterans. Some of this I already went over, and I know we're running up on time. I want to, as far as the partnership, basically, again, it's a very informal process as far as how to make a referral. I am I have 2 locations. I'm physically located here in Manchester, and I'm also up in Tilton. I do travel around New Hampshire and Maine. My extension, and hopefully you folks find this as funny as I do. I put my mobile number up here. I am very reachable, 657-4153. I will put that up there because I don't want folks to get stuck in a phone tree at the VA. You can call the main number, 624-4366, extension 2607. If I could show you my desk, I do not have a desk phone. I have a mobile phone because if you call my extension, it will ring my phone anyway. So I want to be very accessible, one less barrier. Call me with questions and feel free to refer folks to me. There's
So
my.
I just want to say, if anybody has a question, since we're such a small group, please
Yeah.
feel free just to say it out loud, which would be fine. Unmute yourself though, of course.
Great.
Wayne, Dina, or Chip. I have a few questions, but I want to
Great.
give folks opportunity first.
I'm going to stop sharing. See if that worked.
Well, I guess I get started. I will start, and then if people have a question, they can jump in. Mary asked about if there's respite for the caregivers. Do you get, give them time off from this process?
Yes, there is respite, and it's tricky. One, when a caregiver applies, one of the things they have to show is that they do have someone that could provide respite. Right? Another caregiver in the community, it could be a family member, and they go through the same process, the background check, with Department of Safety and bees.
Great.
Oh, and I had another caveat to that too. So since the program's brand new, one of the things is in more established programs, respite is built in with the more medical foster homes you have. So if I had, let's say in Manchester, if I had 5 medical foster homes in the Manchester area, all approved for 3 veterans, but each one only has 1 or 2 veterans in the home, they have another open bedroom for a veteran. So they in established programs, they provide respite for each other.
That's very nice.
Right. The more homes you have, there's more respite. So it's just one of the deficits of this. It's a new program, so that system's not built yet.
That's great.
But it will be.
Yeah. And so can a family member be a caregiver? Can they be a spouse or a partner or a family member apply to become a caregiver to your program?
Absolutely.
Yeah.
But not for, and here's the caveat. One of the driving forces behind this is to expand the options for veterans, right? So if somebody is, let's say if I'm already caring for my dad, my dad's was Army, so, and I'm a family caregiver, and I apply to be a medical foster home caregiver, I can't just care for my dad. I have to open it up. So provide more housing opportunities for other veterans in the state. So I have another bedroom in my home. That bedroom would be so I'd be certified for 2, right? So I'd have to have another veteran to care for me.
Sounds good.
Yep.
In regards to costs, I understand that, you know, people pay for their room and board and then their care needs are separate from that. And there's hopefully some assistance coming down for this state
Room and board.
program. But is that for room and board or for costs, caregiving costs, or what is that for?
All of the above.
All of the above. That's great. Yeah.
Yep, and they're trying to figure out the tiered system, and they're doing it regionally. So they're not the the VA is not going to pay the same in, let's say, San Francisco that they would for, you know, Baton Rouge, that they would in York, Maine. You know what I mean? So they're trying to figure out a regional tiered system on what the levels are going to be.
Mhm. A tiered system in terms of care needs, I would imagine. Yeah.
Care needs and the cost.
Yeah.
Okay,
Yes. Yeah.
absolutely.
Yeah.
Thanks,
And
Deb.
does your medical team include a medical doctor, or they go into the clinic for their medical care?
There is a provider, there is a provider, and they do, from what I'm hearing around the country, and I haven't convinced the providers here yet. There's actually one provider who's just rearing to go in the community.
Very unique.
Yep. Other providers, they're very office based. So veterans would get transportation to and from a provider appointment, but there are some providers who are very open to going in the community to see a veteran in a home setting. So we'll work on that.
Yeah. And how about like substance abuse problems? You
Oh,
said
yeah.
you have mental health problems, but substance abuse as well. Yeah.
Yep, mental health and substance use, some active, that actually has been one of the, I sit on a panel, and I've heard some of the discussions on problem solving. So a veteran who is going out to the club or the, let's say club in general. So that's a good umbrella term. And they're having a liquid lunch every day and then coming back to the medical foster home under the influence. That is becoming a problem where a coordinator ends up going to the home to, you know, what is it, caregiver veteran relations, and trying to hammer this out because there are some effects of that downstream for the caregiver and the family.
And do you know that before the person moves in, hopefully? Yeah.
Yep, there's a history. Yep. There's a
Not
history.
always, but yeah.
Not always, and then it can be an expectation because there's very bluntly, I did sit in with a veteran and a potential caregiver, and they said, "Look, I'm independent. I want to be left alone. I can clean my own room. You can stay out." And the caregiver right back said, "This is, you know, this is my home. You're a guest. This is what I basically, this is what I agree to do. This is what I agree not to do." So it was very much a give and take on this contract, basically, between them on what that living arrangement would be like.
Mhm.
And it can change over time.
Oops, sorry, also, are you having, that would be your role to help negotiate those
Oh, yes.
situations, I would imagine.
I'll be at the
So
table.
is there mental health people and spiritual and recreational people that go into the home, or do they go to the clinic for those kinds of things?
Well, how do I say that? Yes, and
Mhm.
so we have a member of the clergy here who is both in the community and here on site. So he would love the opportunity to go out into the community and visit. So, you know, we have recreational therapists, occupational therapists who are also rearing to take veterans on activities in the community.
And the last question I have is, do you have, like, everybody has staffing problems in all these facilities, and probably you're trying to recruit more homes as well.
Yes, ma'am.
Yeah, so I know that's just an ongoing issue for everyone, but
It absolutely is. I mean, for folks if you have any information about the state veterans home, you know, they're like anybody else. I had a question on Monday up in Tilton, said, you know, why am I on such a wait list with the state veterans home? And, you know, I know they have so many beds, and I know they only have this many veterans there. It's, again, it's a staffing issue.
yes, yeah. Are there women veterans that you've been dealing with yet or not? Or
Oh,
that you
yes,
have-
absolutely.
Yeah.
I met with a woman veteran last week
Mhm.
who
That's
moved here
great.
from Maine to live with her daughter,
Mhm.
and they inquired about medical foster home.
That's nice. Yeah.
It is, it is.
Yeah. Yeah. I know in some of the foster homes, they get some assistance through the state for, this is in Massachusetts, so to, like a subsidy of some kind, just for the housing piece for the room. Yeah, but I don't think that's true in New Hampshire at this
Well,
time.
I found out, this is new for me. I found out that a housing voucher
Mhm.
can be
Yes.
used,
Yeah.
here in New Hampshire for medical foster home.
That's what I wondered, yeah.
I know, yeah, I'm very excited. So I was expecting it to be closed, another barrier in place, but in this case, it's not. So it actually helps.
Amazing,
I
amazing,
know. Thank you for asking that. I would have completely forgotten.
yeah. Oh.
So we
I
do
was a
have one.
social worker once myself.
Yeah.
I did get a question from Dana. He wanted to know if this was strictly long-term care.
I'll say yes with an asterisk. Um, the idea is for it to be a forever home, but it doesn't necessarily need to be. If a veteran needs to move out or over a period of time, whether it's 6 months, a year, has gone through their own rehabilitation and become well enough to move out, like that also happens. Does that answer your question?
I think Dana has left and I'm not sure where Mary is, but it was a good answer. And
Okay.
I think I don't have any more questions. Mary, are you there? I don't see you.
Yes, I
Okay.
am here, Kathy. I
Okay.
apologize. So, well, thank you, everyone. And, thank you, Kathy, for your help with the chat. And thank you for joining us, Kevin, and telling us about this program. It really does sound
Amazing.
exciting and
I am
a
excited.
wonderful opportunity for the veterans within our state. I do want to thank our audience for joining us for today's coffee and conversation. And I hope that they did find the information and the options that Kevin mentioned to be of value to them, as well as to the veterans within our state. A recording of this coffee and conversation will be posted on the AARP New Hampshire YouTube channel. And thank you everyone so much for your help. And
Thank you, Mary, and thank you, Kevin, and thank you for joining us today. It was wonderful.
Thank you all so much.
Yeah, thank you.
okay,
Bye.
Bye now.
oops.